I use the CPMS virtually on a daily basis. It's not complicated. There's this progression, there's this flow, so that you have a broader understanding of the best approach to deploy at the field level. And it's very realistic.
It's really helping us, as a coordinator. For me, it's really helped a lot using as a guidance document when we were developing on the humanitarian response plan. So that really helped to outline the key strategies, like, bringing out child protection issues or to agree on the common indicators.
I think the CPMS provides us now with a framework for response. So the standards actually provide us with a stepping stone. They provide us a platform for the response, but for sure they need to be contextualized because different scenarios provide different issues.
It was important for me to start helping my counterparts changing their mindset of being in a developing country, maybe one of the most advanced in South America or in Latin America in the last decades, and transitioning to the fact that they are now in a context of an emergency. So for me, having CPMS was very important in helping our counterparts in Venezuela changing their mindset and being able to adapt their response.
During the COVID-19 response, the CPMS Child Protection Minimum Standard came handy, because when it was anticipated that there was going to be a lockdown and maybe a temporal closure of the safe space and all that, we also realized that there was a need for business continuity too, and for us to develop a business continuity plan. So we looked at several resources that were developed, and very fortunately for us as an MHPSS organization, we saw in the key action for the standard 10 on MHPSS, which also predicted possibilities of pandemic and how we can continue with service. And that is deploying community-based approach and peer-to-peer approach, family approach, and all that.
COVID-19 being a health emergency, health and wash emergency, we found that in a lot of places, we're not able to access children. We had an issue with migrant returnees coming in from Thailand and other places who had to be placed in quarantine for quite some time, and child protection actors couldn't access these. So through UNICEF, working with the Child Protection Working Group, we developed guidance for health workers to be able to deliver child protection interventions. So this guidance included MHPSS. It also included case management packages. It also included NFIs, basically something like dignity kits for the children. So it was age appropriate and also gender sensitive packages. So we developed these and trained about 365 health workers to deliver interventions in quarantine centers.
So the Philippine National Child Protection Working Group has been using the Child Protection Minimum Standards as one of its key references. More recently, we have used the Child Protection Minimum Standards in developing what we call the National Child Protection Working Group's new normal guidelines for COVID context. So for this particular process, we selected 5 of the 28 standards to ensure that those 5 standards would include Philippine COVID context. And the resulting document has been shared with the Intercluster Coordinating Group as part of the key documents in COVID programming.
Recently, during the COVID response, we took the opportunity to enhance the integration of child protection into nutrition, health, and education. And the CP minimum standards from 2019 were very useful in guiding us as to how we can prepare the information to educate health workers, nutrition workers, and education practitioners on the minimum standards, how those can be integrated into their work. We actually have good examples of projects that are integrated with child protection, nutrition, and health, which have been funded by DFID. And this particular project that is being run in the 3 states in Adamawa, Bono, and Yobe shows examples of how nutrition facilities can be used to identify child protection issues, how child protection facilities can be used to identify nutrition issues, and the same with health.
We're also working with ILO to look into the child labor aspect of the minimum standards and include the work that ILO is doing with regards to child labor and most hazardous work for children, to create advocacy points, to create messaging for children, to create community awareness messages, and roll this out in the communities.
I also believe that it's important to use CPMS training in order not only for partners or stakeholders, child protection stakeholders, know what the CPMS are or understand the CPMS and how they can use them on their daily work, but also to bring to the table sensitive issues that are affecting children. So in my experience, I have used CPMS training to sensitize counterparts, but also to bring from the floor, directly from the stakeholders, issues that are affecting children that are sensitive, but that need to be taken into account in order to have an effective response to children's needs.
So whenever we have a specific emergency or even for programming for future emergencies, we always refer to the CPMS so that we are guided on what we need to consider for our programming exercise. And for example, within UNICEF, we have the emergency preparedness planning. So every time we have a new scenario that we have to prepare for, I use the child protection minimum standard so that the specific considerations for every emergency is factored in the planning process and also in the response phase. And it's also a good advocacy tool because it sets the baseline for all of the standards. So whenever we have orientation activities with different child protection members, we always refer to the CPMS so that we are able to ensure that all the guidelines are considered in our context.
Each of the coordination meetings we have, we're ensuring that we use it as a learning experience, as a learning session, whereby we dedicate 30 minutes of every child protection meeting as a way of learning and bringing to board other members, the senior managers, on what the standards are for the minimum standard. So the last month, the Monday meeting, we did go deeper in terms of the psychosocial support. We looked at psychosocial support in terms of what do the standards say in terms of the preparedness, in terms of the response, and also how do we measure.
In terms of monitoring response and progress, the Philippine National Child Protection Working Group has developed our own rolling work plan, wherein specific standards are integrated and prioritized in our national level work plan. So those priorities are patterned after the specific recommendations from the CPMS in terms of, for example, preparing specific set of guidelines for separated and accompanied children. So those are priorities that can be attended to at the national level so that smaller local government units are guided.
The quality benchmark, it's a certain checklist, let's say, or questions outlined under each area of interventions. So let's say the case management, and to say to monitor whether the case management caseworkers are adequately enough to support the children in this area, or how many visits has been contacted, are they really following the certain guiding principle. So it's a kind of a checklist that we outline. So that's called quality benchmark, that actually based on the on the minimum standard to build the CFSs, how should be there, how should be structured, how do you involve community, how do you involve children as as a preparation, as implementation, and what activities and how activities are being run in that center. So all these things is really help us as a guiding. So we had, based on the minimum standards, we developed a quality benchmark that really help us to monitor the intervention.